Go ahead.
We have a 5-year-old girl with both legs pinned under the left front tire of the car. 8-year-old brother was playing in the car. Car is on a slight downward incline with a manual transmission. Dad did not usually set the parking.
Dad was watching the kids. Typical.
Girl
He's
had
watching reruns of Monday Night Football.
and the girl had shot.
Not this
Thanks.
week's Monday Night Football.
So, what do you want to do first?
Get the fire department to lift the car.
Okay. Or at least secure the car.
Yeah. Things you want to do before that, though?
Yeah.
I mean, yes, summons the fire department to come help you get the car.
First thing, when you say the size is enough, you need to assess for needing extra equipment or supplies with personnel. So I'd have the fire department come in. Then what are we going to do?
Make sure the cars are parked.
We'll make sure it's not going to move.
Yeah, it's
Well,
a
make sure it's not,
it's a
new
manual
car, there's all
transmission.
sorts
So.
of stuff that's gonna
Key fobs?
Yeah. Stick around.
We put the tire right across both thighs, mid thigh. So we created compartments in them.
Well, that was nice of you.
Yeah, the parking syndrome is not. It's there,
And
but
she's
it'll
playing
be-
like outside of the car,
No.
like, rather than
But-
underneath it.
Yeah, it's going to
The
be there.
potential.
Yeah.
We didn't create for it.
Okay, so we've got the car in park, or parking brakes out or whatever, so it's secured, so it's not gonna go anywhere. Fire department's coming to lift it off.
So what do we do with the kid?
The kid's awake, you said?
Yep.
Yeah.
Showing signs of shock.
Yep.
So you want to start
Won't be
IV
once you lift
access?
the car up.
Right. Exactly. That,
You need to prepare to work a cardiac arrest.
Yes.
And you need to prepare the parents. Why don't
somebody go and talk to dad
Say
because they're gonna
their
go.
goodbyes to the child before you lift that car off. That
yeah. Keep starting IVs and all that stuff before.
Yeah.
Start the
Yeah.
yes,
IVs.
absolutely.
But
So
if you
would you
can't,
consider-
can't you do
Does
something
it
to
consider
prevent
sodium
that?
bicarb or something?
Yes.
Kid,
Yes.
kid is 30 kilograms.
It's one
Is that one of
meal
ours?
equivalent.
Yeah.
per
Sodium
person,
bicarb,
isn't
yeah.
it? So it'd be a total of 30.
It's 1 to 2
What about using mass trousers?
kilogram for
Only North is the only one that carries pediatric mass trials.
Does anybody have pediatric masks for this so that maybe you could put those, inflate those up before you take the car off?
WITC does.
How you gonna get them on when the tires are on the patient?
And then I still
Yeah.
have kids in there and I drink it like
Just a question. I didn't know how far you have it on.
Well,
On the
yeah,
thighs.
okay,
Tires
but
are on the
let's,
On the thighs?
but let's follow that through.
Okay.
Can you get tourniquets up on his thighs?
That would be another option,
You
wouldn't it?
can.
Because you
said
could
that
type-
like
if it's a
5 minutes ago.
What,
Would it?
You know.
If it's
Well,
a
come on,
possibility.
speak up.
Speak up.
But yes, absolutely, you can.
Good.
What are you trying to prevent?
Lactic acid, Russian lactic
Good.
acid.
Excellent.
And
Okay,
sudden
so-
rush in.
So if they didn't have tourniquets,
You could make some.
then you would be prepared with bicarb.
Bicarb and
Okay.
fluid
Yeah.
bolus.
2 million
Yeah, and
equivalents per
fluid,
kilogram.
because you're gonna have the blood going out.
When do you want to give that bicarb?
Right as you're releasing it. As you're lifting the car off.
Excellent.
I'm gonna hang blood, I'm just
Good.
going
What would you expect the
there.
anti?
Where would you get that?
You would expect a huge spike in tidal CO2, Steve.
Actually have it, but
That works.
it's done.
Her respirations are 28 in shallow, pulse is 140 and regular, and BP is 78 over 56.
So she's already compensating for traumatic injury.
Okay. What would you expect her end-tidal CO2 to be?
Ooh, Steve. I'm so proud of you.
It's gonna be acid.
She's just starting to,
She should be already acidotic.
yeah, I think that it's gonna be high.
Because the first sign of shock is the increase in
Increasing.
lactic acid.
It's gonna be the known entry.
It's going to be, it should be high. She
It'll
should
be above, above
Should
45.
be above 45.
We're in a clinical study of lactate, and we put these sensors on to see if they're hypoxic. It's a
double blind
region
study.
study. So we do lactate levels and.
Cool.
What's something else you should do with this patient? What other vital signs should you be looking at this patient?
SpO2 and blood sugar. And nurse would
You
tell
could, yeah.
Any good nurse will tell you that, right, Mitch?
Kate is so giving you the bags.
Yeah,
There you go.
but, got a
But
good,
what else? I mean, we know her heart rate.
So she already needs a fluid bolus, so she needs 2 megs per kilogram of lactated ringers now.
Good.
Or you could just use
Lori's
Lori's
blood.
blood.
Keep
Or
these
like-
lactated rivers with the blood, so just take the normal saline. Just
We
say-
always don't have lactated.
I know.
But what else?
We've got
Yeah,
respiration.
two
What's
lines,
your
one for the
pressure?
blood and one for the LR.
Pressure was 70.
8/56.
Okay, so we've got,
That's
we've
right.
got our pressure, respirations, depth and quality. We've got our rate,
We got a rate.
skin color and conditions. Rate and regularity.
What kind of CMS
Is
do you
there-
have on the extremities?
Hook her up to your four-lead.
Is she starting to throw activity on there?
What'd you say?
I said hook her up to your four-lead.
No.
It's
Go bigger.
like, T-waves.
Well, you want a 12-lead, but
Did we give her
on a
spike T-waves?
5-year-old.
We did?
We did.
6-year-old. I'm not sure. I
So she's
think of
hyperkalemic
it.
from the crush.
Yes.
I think of it,
No problem. Little calcium chloride.
Thank you.
No problem.
Yeah, but that's one of the things you need to be prepared for,
Whatever you carry.
you know.
Okay. Isn't one the sledgehammer and the other one's a volcano?
Calcium chloride's a sledgehammer.
Sledgehammer.
The child's gonna, I mean, it's not looking good
You
anyway.
guys have-
No, we have.
The kids survive those all the time.
LMC has.
And what are you gonna see
Gluconate.
on the monitor to know that you
I
Gluconate.
thought we carried Gluconate.
We are.
I thought you guys were.
I'm better.
What are you gonna see on the monitor to know that you should get that?
High peak T waves.
So how much you gonna push? How much calcium chloride you gonna push? I can't-
It's calcium chloride,
Well, why can't we do it?
I don't know, I haven't looked it up.
We don't carry.
I
It
followed
used to
off
be
of the
10
charts
milligrams per
someplace.
kilogram, but I think they changed
Did you push it? Watch your monitor?
Never used
I don't know.
carry it.
Can you? No. Watch those T waves come down?
Push it,
But
go
don't
slow,
you have
watch
to get
your
bicarb
monitor.
with it too?
Push it, watch, monitor. And
Be careful of
Just push
bicarb.
real slow, watch your monitor.
And what else would you give?
well, the sodium
A bolus of
bicarbonation.
diesel
Glucagon, for bringing the potassium down.
or aviation fuel.
And so we'll,
And,
yeah, albuterol.
and then they need to do KX.
But if you push the glucagon,
You got it.
you're supposed to follow, I just read something on this, you're supposed to follow it up with
insulin.
the drip, and then you're gonna make them hyperglycemic, which makes the trauma worse.
So you really don't want to do that.
Mortality. So it's kinda
I just read no
problematic.
glucose and trauma if you can,
Yeah, I
if you
just
can
read something
prevent
on that.
because of the, yeah, exactly.
It's different than a metabolic cause for hyperglycemia.
Right.
So just, you can't, I'm not saying you're wrong, but there's just other,
I'm just
you might be
thinking how
just
you're
starting
gonna
to
bring
chase your
potassium
tail.
down, yeah.
They always say, I mean, obviously, you're gonna have, it's more exacerbated because of the crush injury,
Right.
but they always say not to treat hyperkalemia in trauma patients within the first 24 to 48 hours, because it's always gonna go up. And like I said, they might be different because this is a crush injury, a severe crush injury, but,
Right, as soon as you get the lips, you get the
right.
lactic acid, and
Right.
then you get the rush. You wanna keep that from going any higher than what it is, and you're gonna control that.
But you're not gonna be as aggressive in a trauma patient as you would be in a medical patient.
Right.
Awesome. We saved them.
Everyone so far. Now,
Last
see,
one.